Please welcome your host for this evening, Fred MacAulay.
Thank you very much indeed, ladies and gentlemen. Good evening. Welcome to the Scottish Health Awards 2021. These awards are now in their 20th year. This is my 10th year, so I've done half of them. And this year, I need hardly tell you people, more important than ever. There's no doubt that the past 21 months have been difficult for all of us, but there's definitely been one group of inspiring people who have been our saving grace, you, our healthcare heroes. This evening is all about recognising the outstanding contributions that you've all made to healthcare over the last year. Our 52 finalists here tonight are a testament to the remarkable commitment and devotion that is given to patients across our NHS and partner organisations day in, day out. You all deserve a night to remember, and we're going to try to give you just that. Like I mentioned before, you have put in a phenomenal effort this past year, and you made it extremely difficult for the judges to select their shortlist of finalists and winners with all your inspiring hard work and commitment. We had over 500 nominations this year. Can you believe that? We're going to be presenting 16 awards tonight, 9 before dinner, and then the remaining few afterwards. I know you'll all be hungry, so please enjoy the canapes on your table during the first half of the awards. You'll find details of each of our nominees within the event programme, and in reading it, I hope you'll agree that there is no shortage of worthy winners. Nobody knows more about pandemic safety than everyone here, so at the risk of preaching to the converted, we kindly ask that you're being considerate tonight of others and the distance they may wish to keep to stay comfortable. So please remember to wear a face covering when not seated at your table. A polite notice to presenters and winners coming up on the stage this evening: please wear your face covering on your way up here, but when you arrive on stage, you're entitled to remove the face covering. And there's a marking on the stage over to my left where we'd appreciate winners to make their way to after receiving their trophy, and we've got a standalone microphone there that you can speak from. I'll invite someone from our sponsors to the stage. I'll then announce the finalists, then the sponsor will announce the winners. And for some of the winners, we've got VTs that will be shown on the screen detailing why they've been chosen by the judges. The winners will then be invited onto the stage to collect their trophies, and for other categories, I'll read out their achievements as they make their way to the stage. All of the winners will be able to say a few words from the microphone on my left. Now, if you want to tweet about our finalists or winners tonight, make sure you use the awards hashtag, ScotHealthAwards. If you forget the hashtag, you'll find it in your programme, and we hope that those of you that have made it here have a great night, and we celebrate your success. Now, before we get started with the first award, we have a couple of personal welcomes. Firstly, please put your hands together as we welcome to the stage the Health and Education Editor of the Daily Record. It's Vivienne Aitken.
Good evening, and on behalf of the Daily Record, welcome to the 20th Annual Scottish Health Awards. And may I just start by saying how wonderful it is to see you all in the flesh again, so as to speak. The Daily Record has always been proud to be associated with these awards in conjunction with the Scottish Government, but never more so than this year. All of us gathered together tonight know only too well what an absolutely hellish 21 months we have endured. And we all know the spectre of COVID is still with us at this feast. I personally have lost 2 friends to the pandemic. Both were battling cancer, but that doesn't make their loss any less acutely felt. And I would be surprised if anyone here tonight didn't know someone who's lost their life to COVID-19. But of course, on a professional level, you have dealt with the virus every single day. And I cannot begin to tell you how much we all appreciate everything you have done for us. Some of our wonderful NHS and care staff, however, have paid the ultimate price for their care of us, our families and friends. There are no words of appreciation which will ever even come close to thank those who gave their lives to care for us, those who could not stay home to protect themselves and their families, and those who must never be forgotten as we battle on to beat the virus. And while there are undoubtedly questions to be answered on the handling of the pandemic, now is not the time. Tonight is a celebration of you and all you have done to keep the NHS ticking over during the country's biggest health crisis in living memory. We cannot begin to imagine what you have had to deal with and what horrors you have witnessed, but please be assured we are beyond grateful. Looking at the statements lodged on behalf of nominees this year, there are certain phrases which keep reappearing. Went above and beyond, invaluable during the pandemic, and inspirational are some which could equally be applied to every one of the nurse, doctor, care worker, or allied health professional nominees in this room. But it is the innovative ways nominees have worked to deliver their normal services during the most abnormal of times which have impressed the most. We will hear later about that innovation and why we can be truly proud of our NHS. And it is not only Scottish patients who have benefited from your valuable experience. Globally, we have champions who have helped in far-flung spots like Zambia, Tristan da Cunha, Ghana and Malawi, not to mention the sterling work being done at home among our vulnerable asylum-seeking brothers and sisters. We have nominees here from every part of Scotland, showing the talent in our NHS is not confined to our big cities, and some of the incredible skills found in local communities will undoubtedly be rolled out across the country, eventually benefiting our entire population. But there would be no winners without judges, so let me thank ours for their time and diligence in choosing those who will take home the trophies tonight. It is clear that the decisions this year must have been amongst the most difficult ever. And let me assure every one of the nominees here that even getting to this stage is a remarkable achievement considering the hundreds of entries we received. May I also at this stage pay tribute to long-standing judge and great supporter of these awards, Unison's Tam Watterson, who died suddenly in September. These awards will be a quieter party without him, and my sincere condolences go to Unison and his family on such a huge loss. I would also like to thank, before I finish, the Daily Records events team for their work in bringing us all together once more in this fabulous venue. But tonight is about you the nominees, you the beating heart of our NHS. Enjoy every minute, you have most certainly deserved it.
Thanks very much, Vivienne. I'd also personally like to pass on my condolences to Tam's family and the Unison staff here tonight. Tam will certainly be missed and remembered. Now, one more welcome before we get started. Please put your hands together again and welcome Scotland's Cabinet Secretary for Health and Social Care, Humza Yousaf, MSP.
Good evening, ladies and gentlemen. Genuine pleasure to see you all. Except Jason Leach. And look, I love him. No, don't have sympathy for him. Because every time that guy walks into my office, he's there to deliver me bad news. Oh, there's a surge, it's norovirus, it's avian flu. So, no, but he's done a great job for us. So it is a genuine pleasure to see you all here. Don't clap. Every time you clap, his ego gets bigger, and it's just honestly, I have to hear about it and how wonderful he is. No, he is. He's great, and the whole Scottish Government team, particularly our clinicians who have worked extraordinarily hard. So it is a genuine pleasure. It is wonderful to be at an in-person event again. I think we've all missed that interaction. For me, I had this speech written up, and actually, to be honest, I can just park it to the side because there's really two things that I have to do that are really simple. One, first and foremost, is to give some thanks. That is, of course, thanks to all of the people that have organised tonight. My thanks to the Daily Records events team My thanks to all of those sponsors as well. Without your sponsorship, we couldn't be celebrating the heroes that we are going to be celebrating tonight. But secondly, and perhaps more importantly, the easy job I have to do, but is one that is genuinely heartfelt, is to thank every single one of you. I'm not going to patronise you and pretend that I know what it's like to work in an A&E ward doing a 12 or 14-hour shift on a Friday night. I don't. I'm not going to patronise you by pretending I know what it's like being a paramedic attending a cardiac arrest situation. I don't. I'm not going to patronise you by telling you what I know what it's like to work in primary care or a care home in the midst of a pandemic. I don't. But what I can do as the Cabinet Secretary for Health is give you a genuine, sincere and heartfelt thanks for everything that you have done and do for us to this very day. And I extend that thanks not just from me as the Cabinet Secretary for Health, but I know I speak on behalf of the First Minister and the entire Scottish Government, and dare I say it, even my colleagues I know that are here from different political parties right across the political spectrum. I know every single one of us not just values what you do, but my goodness, we are grateful that in our greatest hour of need, it is you. It is you that we can rely on, and it is you that we can turn to. So thank you for all that you have done for us. And let me add, just to end, my condolences also to the family of Tam Waterston and the whole Unison family. I didn't know Tam particularly well. I've dealt with him a couple of times. But I did speak to a few of my colleagues who knew Tam, and I read some of the messages of condolence after his passing. And there's one word that really stuck out when I read and heard about Tam, and that was the word formidable. And my goodness, you definitely want formidable from your union rep for sure. So my condolences to the family of Tam, but also to the Unison colleagues and the wider trade union family. So that is all I've got to say. I'm delighted I'm going to be here at during the awards. I think I'm going to be giving out the awards. And they did say to me, look, Cabinet Secretary, you've got one job to do, and it's really easy. You just give over the awards. Just don't drop them, or do anything clumsy. And I said, clumsy? I'm not like I've ever fallen off my mobility scooter in the middle of Parliament in front of the entire nation. So look, it should be pretty easy. So on that note, I really look forward to the awards, and thank you to all of you for all that you've done during the pandemic and you continue to do for us.
Thanks very much, Cabinet Secretary, or I'm sure I can just call you Humza. We've shared the stage many times over the last decade or so. I think transport, and I think in the 10 years that I've been here, you're the 5th Cabinet Secretary for Health, and I'll explain why I've only danced with 4 of them in the past. And there'll be no dancing tonight, incidentally. You're going to stay on stage to present the winning trophy, so we'll get started straight away. And this event, and I say this in all sincerity because I do a number of them, this is the one where the applause for the nominees is genuine, heartfelt and enthusiastic, and I know we're going to get the same tonight. Obviously numbers are a wee bit down on normal for obvious reasons, so I look forward to you welcoming and appreciating everybody that gets nominated. And first up, it's the Support Worker Award, sponsored by Unison Lothian, and this award recognises the indispensable individuals who work in support roles providing care and services to people in Scotland. We've got 3 finalists in this and in most of the categories, and we begin to your enthusiastic applause with Steph Mackenzie, NHS Highland. Angela Shaw, NHS Lanarkshire. And Margaret Ann Stewart, NHS Forth Valley.
My name is Lynn Stewart, and I'm actually the big sister of Tom Waterston that we knew him as Tom, his family. So I was actually honoured to be asked to do this, because not only was he a formidable character, he was an avid supporter of the Daily Record Health Awards. I can't remember what I was going to say now. But apart from that, apart from being Tom's very proud big sister, I've also been a nurse for 40 years. And I know I didn't look like it. And I know the importance of good support workers. The support workers within any area within NHS Scotland actually are the backbone, I think, of where we can deliver patient-centred care. So, yeah.
Go for it, Lynn.
So I'm delighted to announce that the winner of the Support Worker Award is Angela Shaw.
There's a very special person within Kirkland's Hospital in Bothwell whose work is vastly appreciated by all who come into contact with her. Angela Shaw is a clinical support worker for NHS Lanarkshire, and she was nominated for going beyond her role. As the COVID pandemic hit hard, Angela rose to the challenge by increasing her skills in a vital area.
I'd seen the course was advertised and I approached my line manager at the time, who agreed that I could go on the course. That allows me to go and give the patients their medication as prescribed from the hospital. So when any of our TB patients are started medication, I could collect their medication for them and then go in every day and just dispense their medication out for them.
Teamwork is what makes Kirkland's tick, and Angela's cheery disposition and willingness to provide support and suggestions have been key.
She just goes above and beyond constantly within her job. Whenever COVID hit, anything I asked her to do, she could turn her hand to it. You know, she worked with the admin staff. She just stepped up. We helped with the community testing, even if it was going down to a place we had to test late at night and into the next day.
We were basically just handed a set of keys for a transit van. I don't think I've ever driven a transit van before in my life. So we had this transit van, and Karen and I, we went to the kind of local hardware store and got some big, large containers, kind of plastic containers, to hold every piece of equipment in that we think of: FFP3 masks, visors, gowns, aprons, wipes, everything, you name it.
What's evident in meeting Angela is her sense of fun.
She's very shy, but she's got a really good sense of humour. In my career as a nurse, a long, lengthy career as a nurse and a midwife, I've never met anyone like Angela. She's just amazing.
The winner of the Support Worker Award is Angela Shaw.
Wow, thank you very much. I didn't expect this. There was another two amazing people in the same category as myself. But I wouldn't be able to do my job if it wasn't for the team that are behind me. Karen, that nominated me, Caroline, Dr Kennedy, and the full public health team back at Kirkland's and NHS Lanarkshire. Thank you.
Many congratulations, Angela, our first winner of the night. And let's have another round of applause for Lynn, Tam's big sister. The next award is the Innovation Award, sponsored by NHS Research Scotland and Scottish Health Innovations Limited, or as you know them, SHIL. NHS Scotland actively encourages new and innovative ways to improve the quality of healthcare and the health of the nation. This category aims to recognise forward-thinking innovation and creativity. To announce the winner of the Innovation Award, Scottish Health Innovations Limited Executive Chair, Graham Watson. Graham, good evening. Our three finalists in this category are Mental Health Pathways, Scottish Ambulance Service, NHS 24 and Police Scotland. Macmillan Scottish Mesothelioma Network, NHS Greater Glasgow and Clyde. And the National Notification Service Project Team. Graham, if you'd be so kind, will you now let us know who this year's winner is?
Thanks, Fred, and I'm delighted to be here this evening presenting the 2021 Innovation Award on behalf of Scottish Health Innovations and NHS Research Scotland. Every day we see how research and innovation go hand in hand to drive health and social care forward in Scotland. Over the last 18 months, NHS Research Scotland has worked with colleagues across Scotland to deliver vital COVID-19 research. Every health board in Scotland has been research active, and working together has helped to identify treatments, improve care develop vaccines, and ultimately save lives. We now work to restore a diverse portfolio of research across all conditions and improve health outcomes for everyone. At the same time, Scottish Health Innovations has worked with colleagues across Scotland to accelerate impactful healthcare innovations that positively improve health, social and economic outcomes in Scotland. From dedicated COVID-19 innovation calls to more recent calls focusing on frailty and sustainability, our aim is to bring together the right skills, expertise and ambition to unlock the true collective potential of Scotland. Working together to meaningfully shape the future of healthcare has never been more valuable. And so with that, it gives me great pleasure to announce the winner of this year's Innovation Award is Macmillan Scottish Mesothelioma Network.
Prior to 2019, when the Scottish Mesothelioma Network was established, there was only one nurse in Scotland specialising in mesothelioma, a type of cancer caused by exposure to asbestos. Now there are 5 specialist centres across Scotland with 4 clinical leads who are working to change the outcomes for anyone diagnosed with the disease. They provide dedicated support and a clear pathway, as well as working on a national level to reduce variation in care and ensure equitable access to treatment. Up you come, please. Let's have a round of applause for the team from Macmillan.
We didn't expect this. The other nominations were great. As Fred said, mesothelioma is a cancer of the lining of the lung that is incurable, and the big risk was asbestos exposure in the workplace, and it often presents 40, 50 years after that exposure. So people are getting this disease just from going to work, which is an absolute tragedy. Now, I'm not one of the main players in the mesothelioma network. A lot of them are based in Glasgow. I'm only here for geographical reasons because I live up the road. But people like Professor Kevin Blythe, who's the founder and director, and people like Julie here as well, have been major players in recognising the deficiencies in mesothelioma care over the years and decades, and we're trying to correct that now. So thank you very much for this award. Thanks.
Congratulations, and can I just add my personal thanks to what you're doing. My father, after he left the army doing his national service, worked as a railwayman shoveling coal, but in one instance was asked to go and work with asbestos in a shed in Perth, and 51 years later died of mesothelioma. Our third award tonight is the Volunteers Award. Thousands of people give their time freely to help improve the health and well-being of patients, carer and service users of NHS Scotland. Be it running a fundraiser or befriending patients, it's their valuable contribution that counts. Here to let us know who will be picking up the award tonight is Chief Operating Officer of NHS Scotland, John Burns. Three finalists again in this category, and they are AMA Birth Companions, NHS Greater Glasgow and Clyde. Connect Group, Fife Palliative Care Team, NHS Fife. And Heart Start Projects in Argyll and Clyde, Argyll and Bute Health and Social Care Partnership, NHS Greater Glasgow and Clyde. And John, over to you for the winner, please.
Good evening, everyone. It's a great pleasure to be here to announce the award for volunteers. Volunteers give so much of their time to support our services, and I am delighted this evening to say that the winner of the Volunteer Award is Heart Start Projects in Argyll and Clyde.
Heart Start projects teaches members of the community, workplace, school children and staff basic emergency life support and has proven to save lives. The project, which is 25 years old this year, is run by a group of volunteers whose relaxed but professional approach to teaching puts people at ease. Heart Start has trained over 300,000 people since the project started and have raised funds to place over 220 defibrillator devices in the community. Let's welcome them to the stage.
Ladies and gentlemen, Francis and I are very proud to accept this award on behalf of all Heart Start volunteers, past and present, who have made this project so successful. We have both been volunteers for over 20 years, and the reason we continue is because of the lives that have been saved by teaching these simple skills. We have had fantastic support from our Heart Start nurse, Angela McNeil, and Bernie Walker, for whom we are very grateful. I'd like to thank also NHS Greater Glasgow and Clyde, Argyll and Bute Social Care Partnership for funding the project, Save a Life for Scotland for the support, and also Rotary and the Scottish Health Awards for hosting this evening. Thank you very much.
Thank you.
Many congratulations to Heart Start projects, and thank you to our other two finalists for their dedication to their communities. Next up is the Young Achiever Award, always a popular award. It's for an individual who has shown initiative, drive and excellent judgment in their work to achieve exceptional results. To announce the winner, please welcome the Minister for Children and Young People, Claire Hockey, MSP. Evening, Claire. Our three finalists in this category begin with Hannah Carling, North Ayrshire Health and Social Care Partnership. Stephanie Graham, Argyll and Bute Health and Social Care Partnership. And Lisa Walker, NHS National Services Scotland. So, Minister, Claire, it's over to you.
Thanks very much, Fred. I feel so lucky to be able to announce this year's Young Achiever Award, and it goes to Lisa Walker.
Marketing and Communications Manager for National Services Scotland, Lisa provided invaluable support for the NHS Louisa Jordan Temporary Hospital in Glasgow. She volunteered to be part of a project that ultimately required the skills of 6 different health boards, successfully working with a wide range of stakeholder groups and national and international media. Her particular area of strength is social media and digital storytelling, generating 3.46 million tweet impressions in the first month alone. And she's here. Let's hear it for Lisa.
Thank you so much. This is so unexpected, and Hannah and Stephanie, you guys, it was incredible to be in the same category as you guys in the finals, so congratulations to you two too. The NHS Louisa Jordan was a cornerstone of Scotland's COVID response, and it was a pleasure to be part of the communications team there. A huge thank you to Sandy Scott and Simon Cassidy from the NHS Golden Jubilee, and also to John Sartan from NHS 24, who were also part of that communications team. But I was the only one that was under 30, so here I am. The Young Achiever Award wouldn't be possible without the incredible leaders in the NHS who facilitate and allow young people to flourish. So thank you so much to Richard Pigeon, who nominated me, and our Chief Exec, Mary Morgan. Thank you.
Well done, Lisa, and congratulations. 3.5 million Twitter impressions. If you're tweeting tonight, at Fred MacAulay, if you enjoyed me, incidentally. If you don't like me, please, you can tweet that as well, but I'll block you. We're now on to the Midwife Award, sponsored by the Royal College of Midwives. This award is for an individual midwife or team who are providing high quality and compassionate NHS care for women and babies all over Scotland. To announce the winner on behalf of the category sponsor, please welcome Executive Director of External Relations and Interim Director for the Royal College of Midwives for Scotland, John Skews. Our three finalists are Fife Birth at Home Team, NHS Fife. NHS Borders Pregnancy Assessment Unit. And Orkney Midwives, NHS Orkney. John, it's over to you.
So proud of our members, midwives and maternity support workers in Scotland. They held the line during COVID, often at vast personal expense. So the Scottish RCM is pleased to see these great services recognised. And the winner is, and it gives me great pleasure to say this and to announce this, it's the Orkney Midwives.
The team of midwives in Orkney continually demonstrate commitment, innovation and family-oriented personalised care despite the challenges of an island setting. Senior midwife Pam Halliday has developed a team which provides high-quality care to mothers and babies while embracing changes, taking on new skills and providing flexible availability. The team is safely extending its midwifery practices to enable as many women and families as possible to fulfil the aspirations that new generations of Arcadians can be born at home whenever possible. They're here all the way from Orkney.
I obviously have nothing ready because I wasn't expecting that. You have no idea how good it is to take this back to the rest of the team, and they just work so hard to keep, to keep the place running, and just in that island situation can be quite difficult sometimes. I'm so chuffed to be able to take this back. You have no idea.
Congratulations again to the Orkney midwives and to all the midwives in the room. Can I just say, the MacAulay family are delighted to say we're going to need a midwife at some point in the new year. Nothing to do with my wife's 60th birthday, I hasten to add, but I'm going to be a grandpa, which is, yeah. Although, there was a point at which my wife and I did think maybe we could start part 2 of the family, but instead of that, we got involved in fostering and managed to get rid of 2 of our kids. So, on to the 6th category now is the Allied Health Professional Award. Allied health professionals are a distinct group of practitioners who apply their expertise to help people of all ages across many various sectors. Their focus is on prevention and improvement of health and well-being to maximise the potential for individuals to live full lives. Please put your hands together and welcome to the stage Chief Allied Health Professions Officer, Carolyn MacDonald. Carolyn, good evening. Another 3 finalists in this category. We begin with Jane Allison, NHS Borders. From NHS Ayrshire and Arran is Gemma O'Neill. And finally from NHS Greater Glasgow and Clyde, Pamela Vaughan. Carolyn, will you do the honours, please?
Thank you very much. The allied health professions pushing the boundaries during the pandemic and extending their roles and doing fabulous work. I am delighted to announce that the winner of the Allied Health Professional Award is Jane Allison.
Jane Allison, a podiatrist based at Galashiels Health Centre, was the only member of her team able to work full-time at the site during lockdown and went far beyond her normal role. Jane developed close links with the district nurses and shared their caseload of foot ulceration. Enjoy your dinner. She also took on the responsibility for day-to-day running of the podiatry clinics at the health centre and launched a daily hub with podiatrists and other clinics to discuss patients and agree care plans. Will you now welcome her to the stage?
Slightly shocked. I just really want to thank the whole podiatry team in NHS Borders, who all do everything that every podiatrist does across Scotland, which is caring for patients. So it's a huge honour to accept this on behalf of our team in NHS Borders. And just to remember the people we lost in the pandemic, including my cousin Angela Cunningham for NHS Borders. So keep them all dear. Thank you.
Congratulations, Jane, and thank you for that poignant reminder. It's now time for the Integrated Care Award. This is for those who provide vital, high-quality, coordinated care and support that helps people in Scotland in a person-centred, safe and effective way. To announce the winner, please welcome to the stage Chief Executive of NHS Scotland and Director General of Health and Social Care, Caroline Lamb. Evening, Caroline. The three finalists in this category start with Coatbridge Living Well in the Community Team, NHS Lanarkshire. Forth Valley Care Home Assurance, NHS Forth Valley. And Penumbra Milestone ARBD Team, NHS Lothian. Caroline, over to you, please.
Thank you. Good evening, everybody. This is always a fabulous event, but it feels particularly special this evening, and I hope you all have a really tremendous time. Integration has been the most significant change to health and care services since the NHS was established. And through integration, we aim to ensure that people get the best possible care and support by joining up services, by putting them at the centre of those services, and by focusing on preventative and proactive care. Through the course of the pandemic, we've seen countless individuals and teams working tirelessly across our health and care services to make sure that people have been able to get the information, support, care and treatment that they've needed when they've needed it most. We're all enormously grateful to you for everything that you've done and everything that you continue to do in the face of really significant challenges. Thank you. So it gives me great delight to announce that the winner of this year's Integrated Care Award goes to the Coatbridge Living Well in the Community team.
My grandparents are the most fabulous people in my life. You know, they've taught me so many things. The amount of support from everybody, from all the Equals advocacy and the contacts that I then had, it just took the weight off my shoulders right away. I felt that I could entrust in people to give the right care to my grandparents at that time.
As testimonials go, they don't get much better. A glowing tribute to the Coatbridge Living Well in the Community team. Despite constraints from the pandemic, 62 older adults living locally who are at high risk of deterioration were identified and have had positive person-centred outcomes. Central to the delivery of care has been 22 remote multidisciplinary team meetings with at least 5 stakeholders from health, social, community, third sector and supporting staff attending each one.
So I would say overall, having got over the
the sort of initial, oh, it's something else we need to learn to do, that it's actually been very successful. You know, even just the coordinating of the meetings by sending out the invites and knowing that you can make it even if I'm running late in surgery, I know that I'm here and I can still be contacted by people, and so I would say it's been a great success.
The ongoing aim is to improve outcomes and move away from crisis intervention as the only option. Carers, individuals living with frailty who've had this intervention, and staff involved in this work have given extremely positive feedback.
We've put a lot of work into trying to ensure as best we can that the outcome of the meeting is the referral by itself, and that there's not a lot of admin work generated after that. So, and you know, it's huge, absolutely huge benefit to the patients, and hopefully over time that will result in bigger outcomes in terms of hospital stays being reduced, the length of stays being reduced, and people achieving the outcomes in their lives that they want.
But perhaps the final word should be with Elizabeth, who has seen such positive changes in the health of her papa Tommy and gran Pearl.
From my whole heart, I just want to thank everybody for everything that they did.
The Integrated Care Award goes to the Coatbridge Living Well in the Community team, NHS Lanarkshire.
Keep the applause going and welcome them to the stage, the Coatbridge Living Well in the Community team.
We're very overwhelmed that we were delighted we got you as a finalist. This is, by the way, the third time I have been here in the past 20 years. And absolutely, this is the first time we've actually received the award. So thank you so much to everybody, and thank you to the judging panel who voted for us. And I would just like to salute all of those wonderful patients, relatives, friends that we've all lost over this horrendous pandemic, and just to say a big, huge thank you to the wonderful staff we have in the NHS. Thank you.
Congratulations again to Coatbridge, and well done to the other finalists as well. We're speeding through the awards. We're now on to the Care for Mental Health Award. This award highlights the work of mental health professionals and teams across NHS Scotland who work with and support some of the most vulnerable members of our communities. Please welcome to the stage to announce this year's winner, the Minister for Mental Wellbeing and Social Care, Kevin Stewart, MSP. Evening, Kevin. The finalists in this category begin with Leverdale Hospital Inpatient Therapies Team, NHS, Greater Glasgow and Clyde. NHS Grampian Psychological Resilience Hub. And Ross Mackey, NHS Borders. 3 finalists, 1 winner. It's over to you, Minister.
Thank you very much, Fred, and it gives me great pleasure to announce tonight that the winner of the Care and Mental Health Award is NHS Grampian Psychological Resilience Hub.
Jill Strachan and Simon Lloyd lead a unique NHS service in Scotland, one that's bringing huge support to people whose mental health has suffered during COVID-19.
Okay, team, thank you for attending our usual monthly meeting.
The Psychological Resilience Hub, known as PRH, was set up in NHS Grampian at a time of unprecedented psychological distress due to the pandemic.
That's an important part, I think, of what we do as leaders of the hub, is to make sure that our team are well supported in their own right. So we have regular monthly meetings, and we have supervision sessions so that we temperature check how they're doing in terms of the stresses and strains that they have, not only in their own lives but also from kind of dealing with people, individuals with who are struggling.
The virtual service, both online and via video, is the only one of its kind in the country and was set up and running within just a few weeks through the hard work and determination of local NHS and video call sector staff. It has since gone on to support over 4,000 people in all age groups in the Grampian region with their experiences of mental health issues related to the pandemic.
Of our somewhat 4,500 people that we've had contact with since the beginning of the Psychological Resilience Hub, a significant number, over 500, have been children and young people under the age of 18.
So we're supporting people across the lifespan, across the board, and we signpost them to a variety of different online packages such as Beating the Blues and Silver Cloud, and various other computerized cognitive behavioral therapy packages.
The team has also supported other services such as GPs, where long waiting times are a concern. There's been strong positive feedback from over 300 responses. Other providers on a local, national and international level look set to roll out similar services.
With regard to the Psychological Resilience Hub, we review every 6 months with regard to funding, with regard to numbers still utilising the service, and with regard to our waiting list. And taking all that into consideration, we then make plans for the following 6 months, and we would continue to do that until further notice.
The winner of our Care for Mental Health Award is the NHS Grampian Psychological Resilience Hub.
Thank you very much. It's a real honour to receive this award, and amongst some other strong contenders. So we accept this award on behalf of a team of 20 or 30 call handlers who offer some of their time to be members of this team. So I should mention Jill Strachan, who couldn't make it here tonight. It's my co-lead. Instead, we have Siobhan Cowie, who manages the office and the data and recruitment and everything else, and we couldn't do without her. There's been a tsunami of mental health stresses and strains, and we just hope that we've done a small part in helping people to continue and to cope. Thank you.
Well done to the PRH, and our thanks to the Minister for announcing the award tonight. Now for our final award before dinner, the Tackling Health Inequalities Award, sponsored by the Scottish Government. This award aims to recognise the commitment and dedication of those that help to reduce health inequalities, motivating and supporting people in Scotland to make healthy and fulfilling change. On behalf of the category sponsor, please welcome the Minister for Public Health, Women's Health and Sport, Marie Todd, MSP. Marie, good evening. Our three finalists begin with, it's a second nomination for AMA Birth Companions, NHS Greater Glasgow and Clyde. Next, the Prince and Princess of Wales Hospice Transition Clinic Team, NHS Greater Glasgow and Clyde. And the Scottish Ambulance Service Drug Harm Reduction Team. Minister, who's taking home the title?
Thank you very much. It's an absolute privilege to be here and to say thank you to you all. I'm delighted to announce that the winner of the Tackling Health Inequalities Award is AMA Birth Companions.
AMA Birth Companions is a Glasgow-based charity which supports asylum-seeking women who are pregnant or have recently given birth. Socially isolated and living in an unfamiliar culture, there are significant barriers these women have to cross to access the healthcare and support both they and their baby need. The team has supported more than 90 women since 2019 through pregnancy, birth and early parenthood. They are focused on building positive parent-infant relationships by ensuring parents can confidently care for themselves and their babies. Let's welcome them to the stage.
Gosh, this is quite a new job for me, so this is a bit daunting, and I'm aware that I'm keeping you from your dinner. I'd like to dedicate this award to the incredible team of volunteers who are by the side of all the women who face pregnancy, birth and becoming a parent against almost insurmountable odds. They are unbelievable, and I'm so proud to work with them. Thank you.
Can I just point out, I got a lovely wave from that recipient there because Abigail used to babysit my kids. I had no idea she was here. Congratulations this year again for all they do for the refugees, their babies, and those still in pregnancy. Congratulations indeed to all the winners so far and our very worthy finalists. You're all winners this evening. I often joke about that, but tonight you really are. Thank you very much, ladies and gentlemen. Welcome back. Two things before we get into the script. The first is I would like you to join with me in showing our appreciation for all the waiting staff on the floor and the people behind the scenes here for dinner. And I don't know about you, I was fortunate enough to be down at table 2, so we had the benefit of hearing Clarissa and her band. Well, I thought she was absolutely fantastic. Can we have a round of applause for Clarissa? Spectacular. That's the kind of thing you'd be treated to in Ronnie's Scotch in Soho. So we want to hear more about the success stories in Scotland's health and social care services. Am I right? Yeah. To present the final 7 trophies, please welcome back Scotland's Cabinet Secretary for Health and Social Care, Humza Yousaf, ladies and gentlemen. Humza, just saying over dinner, he's staying up in Broughty Ferry now. I came through from Glasgow, where we've had COP26, so I set off on Sunday, got here in good time. Somebody had, from Extinction Rebellion, had superglued their face to the M8, and nobody noticed. We weren't going anywhere fast. First up, though, is the Unsung Hero Award. This is for an individual, group or team who are making a real difference for the people of Scotland, working within NHS Scotland or another organisation. These people undertake incredible work that often goes unrecognised. Announcing the winner tonight will be the Chair of the Chief Executives Group and the CEO of NHS Borders, Ralph Roberts. Ralph, welcome to the stage. We have 3 finalists in this category, no surprises there. And we begin, to your applause, as we did in the first half, ladies and gentlemen, with Nabil Arshad, NHS National Services Scotland. Next, NHS Golden Jubilee Prevention and Control of Infection Team. And NHS National Services Scotland COVID Testing Operations Team. And Ralph, it's over to you for the winner's announcement, please.
Thank you very much. And can I just say, before confirming the winner, how delighted I am to be here and announcing this on behalf and representing my colleague chief executives. As people have said, the last 20-odd months have been unique. And I have to say, as having been a chief exec during that time, and I know my colleagues would agree with me, we have never been more humble to have you working for our organisations and showing such commitment to the NHS. So thank you to you all. We do know that the public often overlook the contribution of the thousands of staff working in the background whose contribution is essential, we know, if the services that the public depend on are to be provided effectively and safely. And all 3 nominees this year are excellent examples of this. So I'd like to say, on behalf of everyone in the NHS in Scotland, thank you to all of the unsung heroes who support our services. And that just leaves me to confirm that it gives me great pleasure to announce that the winner of the Unsung Hero Award is Nabil Arshad.
I think probably the proudest moment for me is when I found out from my mum and dad that they'd received their blue letters for the post, knowing that me and my team developed the system.
Although he's not on the front line of medical care, Nabil Arshad played a crucial role in helping the NHS in Scotland rise to the challenge of the pandemic, designing in the first instance the vaccination booking system. As Senior Department Manager for Internal IT within National Services Scotland, he also worked tirelessly with others to develop a solution to support contact tracing as the existing system was overwhelmed.
I think through COVID, it's shown that there's a lot of digital technology that can enable better health and care in Scotland, and I think there's opportunities to do a lot more to support the health and well-being of the citizens of Scotland.
Like many people throughout the country, he embraced this new way of working with remote management catch-up meetings and calls to his 9-strong team. And it wasn't without personal sacrifice, as Nabil worked day and night for many months without a break and without taking any annual leave.
It was just something almost out of a movie, just seeing how closely everyone worked together. It was just absolutely amazing.
Like many folk home working, Nabil's me time has been enhanced by fewer car journeys and the increased joy of fresh air and exercise.
It's just been great getting out there and just, going out, running in the fresh air and, switching off from work and other things. And from a mental health perspective, it's really important to be able to switch off and not always think about work.
For his endless enthusiasm and expertise for the benefit of the NHS, Nabil Arshad wins our Unsung Hero Award.
Thank you. I'm humbled and really grateful. Not one that's used to being in the limelight, but at least I don't run the risk of falling off a scooter like other colleagues. I guess the other nominees in the category are just as deserving, and I've seen firsthand the great work that Janice and the testing operations team have done. The last 12 months have probably been the most challenging but rewarding time in my career. Seeing friends, family and colleagues all positively supported by digital solutions that me and my team have developed has been extremely rewarding and just phenomenal to see. I think everyone in NHS Scotland is an unsung hero. Thank you very much.
I've always thought at these ceremonies that when there is an Unsung Hero Award, rather than giving them a trophy, we should just sing. Anyway, you up for it? Hey, I did 7 nights in Fame Academy. You don't want to hear me sing again. We move on to the nurses now. It's the Nurse Award, sponsored by Unison Glasgow, Clyde and CVS branch. Thank you very much, Unison. This award aims to highlight individuals who deliver high quality and compassionate NHS nursing care for the people of Scotland. To announce the winner on behalf of the category sponsor, please welcome to the stage General Secretary of Unison, Christina McAulay. Well, by far and away the most popular presenter so far, Christina. So we've got 4 nurses rather than 3. And we begin, let's have some applause please, for Carol Edwards, NHS Grampian. From NHS Lanarkshire is Eleanor Grant. Next is Lorna Horn, NHS Ayrshire and Arran. And finally, Fiona Mitchell-Hill, NHS Grampian. All over the country, Christina. Who is the winner, please?
Thank you, Fred. Can I just say, first of all, how nice it is and how heartwarming it was for all of us in unison to hear all the wonderful tributes to our dear friend and comrade Tam. We'll always miss him in unison. He'll never be forgotten. And as General Secretary, a relatively new General Secretary of the biggest union in Scotland and indeed the UK, and the biggest health and care union, can I just say it's an absolute honour to be presenting this award, the Nurse of the Year Award, but also I've never been prouder of the work that our members in unison have done in health, care and across public services. So they've kept us safe and they've kept us looked after throughout this pandemic. But just to announce the winner, I'm delighted to say that the winner of the Nurse Award is Eleanor Grant.
Worked as a single-handed palliative care nurse specialist in University Hospital Wishaw. A nurse for 35 years, she worked for many years in St Andrew's Hospice before rejoining the NHS to make sure hospital patients also received good palliative and end-of-life care. Eleanor takes a great interest in patients and staff alike, having cared for and supported thousands of patients nearing the end of their lives as well as their families.
Thank you very much. I'm all chuffed. I haven't prepared a speech. I feel quite shocked if I get through this without crying. I think I'll be doing well. I think I'd just like to say I'm accepting this award for every nurse in Wishaw General. Thank you.
Eleanor, I'm not surprised you were emotional. It's a great achievement. Many congratulations. Let's hear it again. Nurse of the Year, ladies and gentlemen. Especially the field that you work in. We're on to the doctors now. The Doctor Award recognising NHS consultants and doctors working in hospitals, GP practices, etc. across Scotland, striving to provide high-quality NHS care and vital treatment to patients every day. Announcing our winner tonight will be Chief Medical Officer Gregor Smith. Gregor, good evening. The three finalists in the doctor category begin with Dr. Gurab Chowdhury from NHS Lothian. Next up, Dr. Dominic O'Reilly, NHS Forth Valley. And Dr. Alison Rennie, NHS Greater Glasgow and Clyde. Gregor, CMO, which of these worthy finalists is picking up the award?
Thanks, Fred. Can I just say what a wonderful evening it is again? I mean, some of the stories we've heard tonight have just been fabulous. Before we celebrate our nominees and our award winner tonight from the doctors category, can I just say a huge and very genuine thanks to doctors up and down the country, whether you're working in hospitals, whether you're working in primary care or in public health teams. What you've contributed in terms of your dedication and the quality of care you've provided in such challenging circumstances over this last year has just been quite humbling, and I'm so incredibly proud to be a part of your profession. Tonight we're here to celebrate a particularly three special nominees, and I'm delighted, really delighted to announce that the winner of the Doctor Award is Dr. Gurab Chowdhury.
Gurab is a consultant and clinical lead for respiratory services at Edinburgh Royal Infirmary and played a key role in coordinating COVID patient care in NHS Lothian. Despite the enormity of his role and extra pressures during the pandemic, patients often remark how much they value Gurab's treatment, care and approachable nature. He's here already. He made sure that patients with chest, heart and stroke issues had a clear pathway of support after leaving hospital with the help of third sector workforces. Gurab.
Wow, thank you so much. Very humbled. We all know the last 2021 months been a tough gig for all of us. So I really want to dedicate this award to all the respiratory colleagues that I've worked with in NHS Lothian, be it in the community, be it in the hospital. You guys have really worked hard to make the world a safer place for all our patients, for their families. At times, you've been families to them, and perhaps have, ignored your own families just to look after the patients and just worked relentlessly. So this is to you, all of you. Thank you, Scottish Government. Thank you, Chief Medical Officer, for the honour. The judges, Claire, who nominated me, and all my colleagues, thank you so much. As it happens, it's Diwali night tonight, so I would like to wish all of you happy Diwali. God bless our NHS Scotland. Thank you.
Well said, Gaurav, and many congratulations. And also to the other finalists as well. We now move on to the Global Citizenship Award. This award is for those who, in addition to their health or social care day job, also volunteer in global health and social care work. To make the announcement, please welcome Chairman of NHS Greater Glasgow and Clyde and Chair of NHS Scotland Global Citizenship Programme, Professor John Brown, CBE. John, we've got 3 finalists in this category, and we begin with Dr. Leslie Crichton, NHS Tayside. Again from NHS Tayside, it's Dr. Penelope Granger. And our third and final finalist from NHS Greater Glasgow and Clyde, Stuart Watson. John, if you would please announce the winner.
Well, thank you for that, Fred, and good evening, everyone. It's a great pleasure to be in Edinburgh this evening. You don't often hear a Glaswegian say that, but there I've said it. As well as having the challenge of NHS Greater Glasgow and Clyde, I feel particularly privileged to be the chair of the NHS Scotland Global Citizenship Advisory Board. There are over 650 of NHS Scotland's members working abroad to try and improve the healthcare in countries where people are a lot worse off than us. This is a terrific number of very, very special people. Personally, I would give them all an award, but that's just not practical. So this evening, we're highlighting the contribution of one particular special person, and that person is Stuart Watson.
Stuart, our winner, is the Clinical Director for Plastic Surgery at Glasgow Royal Infirmary and has been involved in global health work for more than 18 years. He's dedicated many hours of his personal time, both at home and travelling, to fundraise as well as use his skills as a plastic surgeon. Stuart's work has seen dramatic improvement of plastic surgery and burn treatment in these countries, and his WhatsApp group with 120 members enables global communication and support about burn care issues. And he's here already, Stuart Watson.
Thank you so much. I really appreciate this. It's absolutely great. Thank you. Congratulations to my co-nominees, Leslie and Penelope, on their fantastic work. Burn injuries are hugely common in poorer countries which are less well developed than us. And over my last 20 years in being involved in helping in those countries, it's been a huge privilege to work with hundreds of NHS Scotland co-workers who have volunteered to help in improving education, burn care and prevention in those countries. So this award, although it's an individual award, is as much for all of those hundreds of people who've been involved in working on those projects with me. I'd also like to thank my employer, NHS GGC, who've been fantastic in supporting me, And finally, I particularly want to thank my wife, Sheila, who's put up with me gallivanting off around the world all sorts of times and ruined lots of holidays and left her to look after things at home. So thank you so much. I hugely appreciate this. Thank you.
Congratulations, Stuart, and thank you, Professor Brown. Our next award is the Leader of the Year Award, sponsored by NHS Education for Scotland. This award category aims to recognise leaders who are outstanding in the work that they do to make change happen, as well as the work they do with others to improve services for the future. To announce this award from category sponsor, we have Board Chair David Garbutt joining us virtually just shortly. I will now read out the finalists. Maureen Firth, NHS Orkney. From NHS Lothian, Judith Newton. And from NHS 5, Katrina Wilson. Let's go to the screens now and hear from David, who's taking the award home.
Good evening. I'm sorry I can't be with you in person this evening to celebrate the awards. There has never been a more important time for us to acknowledge the outstanding contributions of our staff. NHS Education for Scotland is proud to sponsor the award for Leader of the Year. The nominations in this category have all demonstrated inspirational leadership to the teams around them, and that leadership is critical in times of great stress. I am delighted, therefore, to announce that the winner of the award of Leader of the Year is Maureen Firth.
Head of Orkney's Primary Care Service, Maureen Firth is always the first to provide outstanding leadership and support. During the pandemic, she set up a dedicated COVID assessment centre to ensure any patient suffering from symptoms could access face-to-face care, as well as overseeing a vaccination programme which saw 90% of the population jabbed ahead of any mainland health board. From having just a few vaccinators employed within the health board, Maureen developed the service to enable more than 600 vaccinations a day. Maureen is here. Let's hear some applause.
Wow, these things just don't happen to me. So thank you ever so much, everybody. It was actually such a privilege to work through this pandemic. I guess I got maybe the slightly better end, where the community were really thankful and grateful to work with us, because they were so grateful to get the vaccine. So I'm not naive. I accept this award, but I know that I have such a fantastic team that I work with and who I will continue to work with as we try to get out of this pandemic. So thank you ever so much. I really appreciate it. Thank you.
Congratulations, Maureen. Well done to Judith and Katrina too. Well, it's a great night for Orkney, isn't it? Let's have another round of applause for Orkney. Good to see that Orkney is looking after people, whereas Shetland, they're just murdering folk. Need to sort themselves out there, really. We move on to our penultimate award tonight. It's the Top Team Award, sponsored by Unison Scotland. This award highlights Scotland's top NHS team who have demonstrated excellent team working in delivering the best possible quality of care. To announce the winner on behalf of the category sponsor, please welcome Pamela Watterson. I have to admire Unison's enthusiasm. When you see a presenter getting a standing ovation, you know it's special, don't you? The three finalists in this category are Forth Valley Neonatal Unit, NHS Forth Valley; Harlaw Hill Daycare Centre; and NHS 24. Pamela, it's over to you.
Good evening.
I'm the wife of Tom Watterson. It is with a great honour that I've been asked to present this Top Team Award on behalf of Unison. I know Tam would be very proud of all the nominees, as he loved coming to these awards to celebrate the achievements of his NHS colleagues. I'm delighted to say the winner of this year's Top Team Award goes to the Harlow Hill Daycare Centre.
It's been an absolute joy for the team at Harlow Hill Daycare Centre to be back in the swing of things following the relaxation of COVID rules, and a great deal of hard work to make their home as safe as possible. The centre's a long-established charity based in Preston Pans, and for almost 30 years has been the go-to place for advice, assistance and guidance on elderly care, and perhaps just as importantly, fun.
Nearly every time I come, there's entertainment. I think the best thing of it is the laughter, that we get things that, well, just the entertainers that help us. It is good fun, yeah. Get the feet going and we can sing. And sometimes even a wee dram before you go away in the afternoon. It's lovely.
Whether it's a religious service, lunch and entertainment, or everyday companionship, Harlow Hill is a wonderful example of a community at one with each other. Clients who suffer from frailty, dementia-related conditions, social isolation, or whose carers desperately require respite, find support from all the team.
So I'm one of those managers that's very hands-on. I'm not a sitting behind a desk manager. I'm a manager that my team, I'm working with them every day. So they recognise that, and the team spirit in here is fantastic. Everybody seems to want to go the extra mile.
Even when COVID struck and the centre was forced to close its doors, the staff responded by continuing to offer as much support as they could, often in innovative ways.
My husband and I purchased a really good industrial marquee. So we set it up like a bistro, beautiful china cups. They've had fresh flowers every day. Loads of people in the community baking beautiful stuff for us. So it was just fantastic. For some people, they'd had 6 months totally in their house, never had they been over the door. So that was the starting point of us feeling like our Harlow Hill community again.
You get the feeling Harlow Hill's older people never want to leave its welcoming arms. But the good news is they can return tomorrow. The winners of our Top Team Award are Harlow Hill Daycare Centre.
Nothing prepared because I actually never expected for to be getting this tonight. But one thing's for sure, that everybody in here is a big team, because we're all here to provide support and loving care to anybody in our NHS, and the Health and Social Care Partnership in East Lothian who've supported us to keep open during COVID. But as you've seen in the video, we thought the centre's shut, but we can't shut. We need to keep our elderly community, and so we did that. And I think COVID brought communities together in loads of different ways, and that's a positive for COVID, is that people looked after their neighbour, they started to care more, and that's continued in Harlow Hill. And I'm so proud, because their team, 29 years I've worked in our day centre, which is a charity. We've raised funds to buy a bus, and the NHS is big. We're wee, but we work together, and East Lothian Council support us to do that. And I'm ever so proud to be picking up this award tonight. So this is for everybody, but in Harlow Hill and Preston Pans, we're just a wee place, but tonight I feel we're massive. So thank you.
Well done to the team. I've got to say, I saw the VT play earlier, but only the bit with the ladies with the pink Stetsons on. I thought, that's a hell of a hen night. Here we are at the final award of the evening. We've seen some truly inspiring work, haven't we? I'm sure you'll all on the edge of your seats to find out who the winner of our final award is. So I won't keep you waiting any longer. It's time, ladies and gentlemen, for the People's Choice Award, sponsored by Alpha Solway. Once again, we wanted to take the opportunity to recognise the extraordinary work of the NHS Scotland staff, social care staff and carers in responding to the pandemic. Working tirelessly and going above and beyond, these people have provided the very best care for the people of Scotland in their greatest time of need. Two people to welcome to the stage this evening to announce this award winner. Will you please put your hands together and welcome National Clinical Director Jason Leach and from category sponsor Operations Director Cherie Gracie.
Evening, everybody. Well, you can't see a thing from up here. It looks empty from up here. And he does actually have white stilettos on. You just can't see them. I don't know about you, but this has felt like therapy for me. My job is not always positive and optimistic. Those of you who are on Twitter will realise why. This has been absolutely fantastic. We've gone from the guy who invented from nothing our vaccine digital programme to Ghana plastic surgery to midwives for refugees and everything else in between. Genuinely, I could not be more grateful to every single one of you. It's been absolutely fantastic.
Thank you, Jason. Now what I'll do is I'll announce who the finalists are.
You do that.
My turn now. Are you like this with Nicola as well? I'll sort this out.
One more year, Fred.
One more year. Is that what I'm getting?
Yes.
All right. Well. See you next year for a dance, Humza. Okay, the finalists for the People's Choice Award are, to your applause for the final time tonight, Forth Valley Primary Care Multidisciplinary Team. I've got a newfound fondness for Forth Valley. I was taken there by ambulance after a serious road accident last year, so thank you very much for looking after me. Next up, Homeless Health and Asylum Service, Glasgow City Health and Social Care Partnership. Home Start North Lanarkshire, NHS Lanarkshire. Oh, here we go, from Shetland, Lisa Watt, the Shetland Health and Social Care Partnership. I take it back. NHS 5 Community Listening Service Volunteers. And the Scottish Ambulance Service.
So there's only thanks, Fred. There's only one award of the whole evening that is both nominated and voted for, not by this room, not by me, not by the judges, not by anybody in here. This was voted for by the readers of the Daily Record and those who nominated and then voted afterwards. So to present the People's Choice Award from Alpha Solway, who you probably don't know, almost certainly made the PPE you've been wearing for the last 2 years, and we're grateful for everything they've done. Cherie Gracie.
Thank you. Can I start by saying congratulations to every finalist and every person in the room. The courage and inspiration during the last 18-20 months has been inspirational. I'm delighted to announce that this year's winner of the People's Choice Award is Homeless Health and Asylum Service.
This building in the East End houses a team doing incredible work with Glasgow's homeless community, where the ultimate focus is on preserving lives. Unlike other services, the City Health and Social Care Partnership crucially increased its face-to-face contact during COVID-19 due to the level of risk and complexity of their patient group.
We did quite a wide programme along with the kind of council to make sure that we could go to all the homeless provider accommodations and then go into those accommodations, provide the vaccines there. And then we also did outreach clinics within a few of the kind of city centre hubs, including ourselves here. So that was really successful. We had a really good uptake.
Other initiatives including a new patient clinic offering same-day access to assessment and treatment with a focus on addiction prescribing.
Oh, it's been a great help. Amy's my drug worker. Amy gets me coming round at 9:30 in the morning. So they get me up at 8:30 in the morning, so I come round and get my prescription and I'm away again, do you know what I mean?
Naloxone administration had helped save Hugh's life on more than one occasion. Now clean, he's happy to take on the responsibility to help others who may find themselves in a similar situation.
I think drug deaths is the highest in Europe in Scotland, and I think they recognise that as well. Our service users are afraid of dying of drug overdoses, so for them to have a tool that they have that can give them that responsibility to help others is really good.
Knowing what I can save somebody's life, it is a better feeling than what I had before. When I first got it, injected into myself, it is a much better feeling knowing that I can now use this if I think somebody's overdosing, you know what I mean?
And just for good measure, an outreach service for young people was set up, and the women's service was moved to a new female-only base in the city centre. For its tireless work to provide the best possible patient care, our People's Choice Award goes to Homeless Health and Asylum Service, Glasgow City Health and Social Care Partnership.
Guess very shocked to actually win this. We know there was a good bit of stiff competition. You know, we couldn't have done what we've done without the support from a lot of services to make it all happen for the people that we support. And, you know, it's just a big thank you to be involved with all the staff who helped make this happen and all the individual teams that helped make this happen. Thank you. And, you know, I think everybody that's here just now are winners in the eyes of the public for what we do. So, a round of applause to everybody.
Congratulations to the Homeless Health and Asylum Service for their well-deserved win. Listen, we appreciate and thank all of your community contributions this past year. You're an inspiration to us all. And that brings us to the end of the Scottish Health Awards 2021. Before I go, I'd like to extend my congratulations to all of the finalists and winners. A tremendous occasion, I think you'll agree, am I right? I'm honoured to have been involved in celebrating your success tonight at the 20th Annual Scottish Health Awards. Concluding for the night, I would like to say a special thank you to a few people, so you bear with me, please. Thank you to our category sponsors, Unison Scotland, Unison Glasgow Clyde and CVS, and Unison Lothian, NHS Education for Scotland, the Royal College of Midwives, NHS Research Scotland, and Shill and Alpha Solway. Thanks to the Daily Record and the Scottish Government for their continued support of the awards and their commitment to recognising outstanding contributions across NHS Scotland and its partners. Thanks to the Cabinet Secretary for Health and Social Care. Thank you very much, Humza. The various ministers, the Minister for Children and Young People, Minister for Public Health, Women's Health and Sport, and the Minister for Mental Wellbeing and Social Care. Thank you very much for being present this evening. To the awards shortlisters and the judges, for their time and commitment to making difficult decisions on finalists and winners. No mean feat in light of the past year. The number and the calibre of nominations received was phenomenal. To the staff here at the O2 Academy, all the teams involved at the Daily Record, Jill Malcolmson and the team at the Scottish Government Health and Social Care Directorates, all associated with organising this evening's event. Thank you to all of you for your phenomenal work. For me, Fred MacAulay, it's just about time to go. Take care. Keep well and have another great year ahead of you. Thank you so much for all you do. Good night.